Healthcare Sunday on 104.7 KJUL, sponsored by True Care Treatment Centers. Now, your host, Warren Zysman.
Good morning, everyone, and welcome to another edition of Healthcare Sunday on KJUL 104.7 FM, the Jewel of the Valley. Today, I'm very excited. We have a wonderful guest, Dr. Faisal Suba, who is the owner of Alliance Mental Health Specialists over here in Las Vegas. They're known as the premier top psychiatric provider in Las Vegas and in Reno, Nevada. Dr. Suba completed his residency training in psychiatry from the University of Nevada School of Medicine, where he served as chief resident of his program. He is board certified by the American Board of Psychiatry and Neurology. Dr. Suba is currently on faculty with UNLV School of Medicine, where he received the Faculty of the Year Award in 2013, 14, and 2016 from the Department of Psychiatry.
I was sick in 2015.
He is adjunct faculty at Touro University in Las Vegas, Nevada. Dr. Suba has previously served as president of the Las Vegas branch of Nevada Psychiatric Association. Currently, he serves as the medical director of Monte Vista. In 2015 and 2016, Dr. Suba was voted top doctor by Vegas Inc. magazine. Wow, pretty impressive. Dr. Suba received his certificate in ECT from Duke University. He is actively involved in training of nurse practitioners, physician assistants, and medical students. He specializes in the treatment of various psychiatric illnesses, including PTSD, schizophrenia, schizoaffective disorder, depression, anxiety, OCD, ADHD, and bipolar disorder. Our sponsor for today is True Care Treatment Centers. If you or a loved one has a mental health or substance abuse issue and need help, you can call our 24/7 hotline at 833-203-2848. That's 833-203-2848. So without further ado, let's just jump right into it. Dr. Suba, welcome to the show.
Thank you so much, Warren. Thank you for having me on the show.
Great. So everyone, there's a lot of talk about Alliance throughout the behavioral health community as being, the standard. I know you provide a lot of services. You have a lot of psychiatrists and psychiatric medical providers. But one of the things that always kind of stands out about your organization is everyone says you provide the highest quality of service. How have you accomplished that here in the Las Vegas Valley and Reno area?
Warren, I was blessed to have really good people around me. We started Alliance about 3.5 years ago, and we started with just 3 providers. And now we've grown to 10 psychiatrists and 17 mid-levelers. All of the mid-levelers are amazing. They trained under us, under one of the doctors. I think one of the things that was missing in Nevada, it was the outpatient psychiatric practice. There's a shortage of physicians throughout Nevada. We all know that. Mental health, a treatment. I think Nevada's ranked 50th in the nation.
Wow.
So the opportunity was there to provide the service. Most of the psychiatrists in town, a lot of them focus predominantly in the inpatient realm. Financially, that's a little bit, it compensates better because you don't have the overhead. What we wanted to do was we wanted to provide the other service, the outpatient service. We are inpatient as well. Our model is to limit the inpatient stay as much as possible, and then get the patients out into the outpatient arena where they can get a provider that will follow them throughout their entire treatment and provide comprehensive care. And we partner with amazing therapists in the community as well, like True Care, for example.
Oh, thank you, Dr. Suba. So, I think that gives a really good snapshot on Alliance and some of the quality work. I think your dedication to providing outpatient services. When patients are leaving the hospital and they don't have an outpatient service provider, how good is the care? What are the gaps in service when that happens? Because your organization really filled in a huge gap here in Las Vegas and continues to do so. And I really want to kind of highlight that. You said before that a lot of the psychiatrists in town are focused on the inpatient service. But if there isn't a strong quality outpatient psychiatric practice from the go-to, what happens to those clients?
No, it's sad. To get an outpatient appointment, sometimes these patients have to wait months. Before we opened, we did some research. We did, our due diligence, and we were finding that a lot of our inpatient patients were waiting 2-3 months before they could get into to see a provider. I mean, it's a shame, because those patients, once they get discharged from the hospital, one of the most important things is for them to obviously stay compliant on their medications, get the therapy that they need. If they relapse, every time that a patient relapses, especially with a serious illness like schizophrenia or schizoaffective disorder, there's a lot of research that shows that there's something called neuronal apoptosis, which is like cellular death that can occur due to the relapse with the illness. If you can maintain them on the medications, maintain compliance, the hope is you're able to preserve a lot of the cognitive functioning of these patients.
Okay, and you're able to accommodate patients a lot quicker?
Oh, yes. So we ramped up very quick. Our clinic, I believe our wait time is probably less than a week. We can get people in very quickly.
Great. So that's a significant difference than other providers. If folks in the community are interested in calling to make an appointment at your agency, how would they go about making an appointment with Alliance?
I mean, our phone number is 702-485-2100. You can go on the website, alliancemhs.com. We also, we're on Psychology Today, so you can make appointments through there as well. Anything that we can do to help the community, that's what we're here for. We noticed that there were gaps in service in Reno as well, and we opened up a clinic in Reno about 3 months ago, and we're ramping up services over there too. So we hope to continue to expand. I think Pahrump might be in the horizon soon.
Wonderful. It's nice to see that you're showing an interest in helping to meet the psychiatric need, which we know is great throughout the state and in some of the rural areas here as well. In terms of yourself, when did you make the decision you wanted to become a physician, and how did you decide to become a psychiatrist?
Oh, that's a story. I came home from college one day, and my dad, he said, "Oh, I found a medical school that will take you," and I was like, "Oh, really? Seriously, Dad? Like where? I haven't even taken my, I need to like finish college, and I need to, take my my MCATs and this and that." "Oh, don't worry, I took care of it. You're going south." And I'm like, "South? Really? Like where? Like Florida?" "Oh, no. Further south than Florida." "Further south than Florida? Like, what do you mean? Like, what's further south than Florida? Like Puerto Rico?" Like, no. You were going to their DR, their Dominican Republic. And I was like, "Really? The Dominican Republic?" He's like, yes. It has the initials DR for doctor, and that is what you're going to be. And I went. That's a true story. No, but it was actually an amazing experience. The training over there was superb. The clinical training that I received, I can never repay the doctors and the clinicians that taught me. I'm fluent in Spanish, which is a huge asset, especially in this community here in Nevada. There's very few Spanish-speaking providers. And when I was there, the culture, the experience of being able to talk to all these new people and this and that, it really showed me the importance of psychiatry. And when I came back, that was my goal. My goal was to enter this field and try to help as many people as I can.
So it was during your medical experience, the school experience, that you decided you wanted to become a psychiatrist?
Absolutely, yeah.
And you did your residency right here?
I did, yeah. And that was amazing as well. Like, the training that I was able to receive here, the program was relatively new, UNLV School of Medicine had a psychiatry program here. We rotated through UMC, the VA, Southern Nevada Adult Mental Health. I got to experience a lot of the different areas here in Nevada that I thought that once we finished, we could actually help and assist in improving and adding to the mental health care services here. And my wife and I, we spoke a lot about it when I finished, and where we would go, what we would do, and we came to the conclusion that this is the place to settle down and really give back to the community.
Fantastic. So, we have a lot of listeners out there who might be suffering with depression, anxiety. Some may have sought help before, but many have never sought help. They may be working at a job, they may be in school. What are some of the benefits of someone seeking help for depression or anxiety? If they've never sought help before.
So, the most important thing is getting help as soon as possible. I think because of cultural barriers, economic situations, things like that, people wait, and they don't realize how important it is. If we can initiate treatment as quickly as possible, it is so much easier to treat, and the prognosis is so much better. So if there is a loved one out there or a person listening that is suffering with any of the symptoms of depression or any symptom of that's a psychiatric symptom, please call us. Or call someone. I mean, getting help is and quickly is the most important thing.
So I think that's a really good point that you made. Is a lot of times people may not know what's exactly going on. I'm sure you have folks come into your office and they say, "I think I'm dealing with anxiety. I think I'm dealing with depression. I think I'm dealing, I feel sad all the time." And I think what your recommendation is really the best thing. Is if you come in, you get an evaluation done. You can find out exactly what's going on, and then you can make an informed decision.
Yeah, and it's not always a lot of people when they come to me or one of my providers, it's like, oh, you're going to put us on medications. It's not always medications. Medications help, and it doesn't necessarily mean that just because you're suffering with depression that we are going to prescribe pills. We have a very good referral source for therapy, right? And therapy is a very important part of treatment, whether you're on medications or not. So I urge people, please, if that's one of the concerns or barriers for seeking treatment, then that's not accurate.
Well, I think that's really helpful. I think a lot of people worry about, if I go see a psychiatrist, am I going to get written medication? Does that mean I have to take medication? Does that mean I'm crazy? Right? I think you make a good point, and it's great that you and your staff are willing to work with folks based on their personal needs. That's patient-centered care.
Absolutely.
So you mentioned before about Nevada being, ranked last in the nation in mental health services. And so I find this like a really interesting opportunity. Here I am talking to the owner of what's known as the highest quality top psychiatric practice in the state. And, what are some things that I know you've already taken the lead on, but some things that you'd like to see change within the mental health system here so that we can make a dent in going from last closer to first, as a behavioral health community here?
It's a really good question. We as an agency are working with other therapists, psychiatrists, and legislative people. Our current governing body here in Nevada actually has been very supportive of mental health treatment, mental health projects, funding for mental health. I think these are things that are going to make a difference. Awareness, that is another thing. I'm actually really proud of our of the people here in Nevada, especially like our state senators and state legislative people that have helped in bringing that awareness to the community. So people are calling, people are getting help now, and I think that the landscape will change. I think that we are not going to be 50th. I'm hoping that'll change very soon. After the tragedy that occurred on the Strip with the mass shooting, the way that all of the mental health community came together to help support the victims and the families of the victims, that was so touching. And we all are still here to help the victims of that tragedy. But I think it'll get better.
Really well. That definitely makes me feel better. I know you've been doing a tremendous amount of advocacy work, you and your leadership team, and I know a lot of these folks look to you for the expert advice on how to up everybody's game throughout the behavioral health community. And so the fact that you're dedicating your time and service not just to your practice and to your patients and to your staff, but also to our city and our state in terms of making all mental health services better. I want to thank you for all the time that you're volunteering for that.
You're too kind, Warren. I mean, we do what we can, but I mean, there's a lot more work to be done, and there are a lot of people that actually are much more involved than I am in this type of stuff. But again, I am here to help, though. And I want to really serve the community and give back.
Excellent. Can I ask you for some advice for our audience?
Sure.
So a lot of people in our audience were asking questions about they have loved ones and family members who don't want help, but everyone in the family knows they need help. What kind of advice would you give to a family member who maybe has a spouse, a brother, a sister, a mother, or father who clearly has some kind of mental health issue or behavioral health issue, and they're not interested in getting help, but they may be responsible for caring for them? Or
it's always one of the hardest things. If it's a serious thing and the person is a danger to themselves, a danger to others, or unable to care for themselves, then the best thing to do would be to call 911 or 311 and get help, right, from local law officials. And the person is not going to go to jail. I mean, that's a common misconception the family members have. They're not going to get into trouble. Our law enforcement people are very trained in dealing with these types of situations, and the patient will be taken to a hospital and cared for, right? And they'll be seen by a mental health professional, and then from there they'll be able to continue to get help.
So in scenarios where you've seen that happen, where a family member, let's say, they may get law enforcement involved because they're just worried about their loved one who's experiencing some kind of mental health issue. They take them to the hospital. The person starts medication. But sometimes their motivation changes because they're now stabilizing and starting to feel better.
Absolutely. So what happens is when people are suffering from mental illness, especially severe mental illness, like we talked about before, like a severe bipolar manic episode or schizophrenia or a schizoaffective disorder, one of the key things that's lost is insight, like the sense of reality. When they start medications and they start treatment, that comes, hopefully, that the goal is for that to come back. And when that comes back, they realize, one would hope, the importance of treatment, the importance of medications, the importance of therapy, and they'll continue on that course of treatment. But until they have that insight, it's not gonna happen.
That's such an important point. I mean, if a person is suffering, they're living with you, and you get them help, a lot of times when they're suffering, I think what you're saying is that they're just not even aware that they're experiencing depression, anxiety, or some severe mental health issue.
Absolutely.
And when they go into the hospital and start taking medication, they become aware of how bad they felt and how good they feel now, and they have the motivation to follow through. And I think that could be really motivating to our audience, because a lot of the fears that you mentioned before about them calling law enforcement, that maybe their loved one might get in trouble, but if they can go to a hospital and get stabilized, the likelihood of them getting more motivated to follow through with care at psychiatric practices like yours goes up significantly. What are some of your biggest success stories at Alliance? I know you can't, for confidentiality and HIPAA, I'm not asking for names or anything like that, but if you could tell us kind of on like a macro level, some of the big successes that you've seen with clients who maybe came in and they were maybe not functioning at their best level, and how they're doing today after receiving services with you.
So it's like the greatest feeling. That's why I chose this field, right? Because you actually, the difference that you can make in someone's life is it's amazing. Like, and not only their life, but the life of their family members and their circle, of people around them. We've had people that have come in like completely depressed, suicidal, come hopeless, on the verge of just wanting to end their life, and it's the saddest thing to see. But working with them, starting them on the right treatment regimen, providing them with the therapy, you see the change. And there's so many stories like that. I mean, I've been practicing for 13 years, and thankfully, knock on wood, like I've had like those types of stories almost daily. So it's something, like I had a patient the other day, and their family member, like you were saying, like their family member kind of coerced them into coming to see me. The patient didn't want to, but you could tell the affect of the patient completely blunted. Like there was no emotion, nothing. And there was fear of starting medications, or a fear of seeing a psychiatrist. Well, I explained to them, I'm like, look, I'm not here to judge you. I'm not here to force anything upon you. Just think of me as somebody that you can utilize. That I'm working for you to improve your life, right? Like that, someone that can change the way that you feel about things, how you perceive things. And the person started to open up more and more. It was actually a much longer session than I would have expected, but by the end of it, we had a good rapport going, and the patient is planning to come back, and that's such a good feeling to know that I was able to be part of that.
It's one of the biggest breakthroughs you could have with a patient, right?
Yeah.
Is taking them from a state where they're not even interested in seeking help to now being committed to coming in and getting help and getting better. And I think some of the things that you hit on with the impact that mental illness has on the family, when their loved one starts feeling better, everybody around them starts feeling better.
Yeah.
Because it really is an illness that affects the entire family.
Yeah, and eliminating the stigma is one of my goals, in my career. Especially in the minority communities, it's just you're not supposed to see a psychiatrist. You're supposed to be stronger than that. You're supposed to be able to overcome these things on your own, and that's just it doesn't work that way. There's nothing wrong with seeking guidance and seeking help from a medical professional. This is a lot of our illnesses can be genetic, and this misfiring of neurons or it's something that can be fixed, and eliminating that stigma in these minority communities is super important. I think we all need to work on that.
Absolutely, it's a very, very good point. In terms of your personal passion, I mean, I see so much passion and everything you're sharing with us about your work you're doing to advocate, to client care, to your quality staff. What's your passion that keeps you fueled every single day to do the work that you do? It's got to be really hard. Some of the cases that you hear. What fuels you to keep providing such a high quality of service?
I have my own psychiatrist at home, my wife. She actually, she's part of our practice as well. But when you go home, you have to. I mean, you need somebody to help you kind of unwind and something like that. So, so she's been a big support. I'm very lucky to have great coworkers and colleagues and friends and partners. We discuss things and sometimes very difficult cases that are emotionally challenging to deal with. You have to decompress and be able to talk about them.
Yeah, and all your colleagues who I've met, everyone seems like they really enjoy their work and that they have fun at work.
Yes, we have a very fun environment. We're always laughing and joking around and trying to keep it light. And that was the goal, Like when we started the practice, Dr. Park, Dr. Pearson, myself, we wanted to make an agency that we could have fun at, and we could obviously give back and help people. And the financial aspect wasn't really our main thing, because like I said before, it's probably a lot more lucrative to do inpatient work than outpatient. We do both. We do a combination, but the outpatient practice was really that was the goal.
And you filled a huge need and continue to, like you said before, people can get in with you usually within a week and sooner.
Yeah.
So if we have folks in the audience again who are interested in making an appointment, what again, if you can give us the number and contact information.
Sure. So Alliance Mental Health Specialists, it's 702-485-2100, and you can also find us on the web, alliancemhs.com.
Wonderful. It's been really a pleasure to have you on the show. I hope we can have you back again soon.
Oh, I would love to, Warren. Thank you. And it's people like you and shows like this that aid in providing the community with the resources and guides the community in getting help. So you're doing a good job, sir.
Oh, thank you so much, Dr. Suba. So I just want to give a little shout out to our sponsor, True Care Treatment Centers. They have a 24/7 hotline. Their hotline is 833-203-2848. That's 833-203-2848. And again, that's True Care Treatment Centers. If you or a loved one have a behavioral health issue or substance abuse issue, you can reach them 24 hours a day, and they'd be happy to help you get services.
This has been Healthcare Sunday on 104.7 KJUL, sponsored by True Care Treatment Centers.